Hey everyone, Adnan here. Excited for another all-star episode of Digital Health on Air. I am super excited to hang with Dr. Malaz Boustani. We've had a chance to get to know each other over the past few years. And I always find myself, one, just inspired, but coming out smarter every time we get to hang. So Dr. Boustani is at the Indiana University Health, but he wears tons of hats. So he's a leading geriatrician. He's a professor of aging research, and he's the founder and director of a super cool institute who had a chance to spend some time with some of his students, but it's, I want to get the title right, the Center for Health, Innovation, and Implementation Science at Indiana University. So today we're going to talk about his work at the center in particular, and really his perspective on adapting healthcare for an aging population. But he's a wealth of knowledge, so I'm going to ask him a couple of questions that I'm sure he will let the faucet run. So thank you for joining us, Dr. Boustani.
Thank you, Adnan, for the invitation and the opportunity to exchange information with an innovative person like you. So
you're very kind.
Much.
Well, why don't you introduce yourself to the audience here? It's an audience full of curious folks from all spectrums of healthcare and healthcare technology. But tell us a bit about yourself, and then really what led you to found and create the Center for Health Innovation and Implementation Science?
Yeah, so I am a scientist first and physician second. But as a scientist, I'm not a basic scientist. I'm more of an agile scientist. So it's almost like an engineer trying to understand, predict, and then steer the behavior of one human like you, Adnan, and like my patient and my care provider, and the behavior of an organizations like my Center for Health Innovation Implementation Science in the healthcare system. I have a nightmare that is the driving force for everything that I do, which is dying alone in a nursing home with dementia. Like, that's my nightmare. I know my father had similar nightmare, and we were able to overcome that because he actually died in his own home, in his own neighborhood, for the last 12 hours of his life with dementia. So I was very proud that all of the digital technology solution and all the content that I was able to develop over the past 20 years or so, was able, through WhatsApp, able to provide it to my father, who lives in a civil war area in Syria, and I was able to accomplish them. So now I'm very excited about all the tools, process, and strategies that we created in our center within the School of Medicine at Indiana University that are actually, with the right technology and the right infrastructure in this digital health revolution, are scalable to anybody on this planet. So that's my big nightmare. And the good thing, that nightmare is common across multiple family and patients and providers. So it's aligned. And if I can reduce that suffering from that nightmare, I can't imagine what the healthcare system of the future going to look like.
No, absolutely. It hits near to my own heart. A very similar experience for my grandmother, who was late into her 90s with heavy onset dementia. And it's a conversation now my dad and I have. He's in his late 70s, and it's always hard to have that conversation with your parents, but we're able to have it. And like you said, there's now technology around that can enable to have that conversation and think about it very thoughtfully and with options, as opposed to just something being very binary.
Absolutely. I think this is we are lucky in a way that we have a lot of digital infrastructure, and that literally, if you have access to the internet anywhere on this planet, I think we can optimize your health in general and your brain health in particular, and reduce suffering and improve your quality of life. And this Center for Health Innovation Implementation Science try to keep our eyes on that perspective. So our vision is transforming health for better, obviously, but for all and now. So we took into our innovation to constrain the scalability. That's the word for all. Doesn't matter where you live, doesn't matter your educational level, doesn't matter your your underlying social determinant of health. Whatever we transform the care for you, you will be included. Better, obviously, in the eye of the beholder, but we don't think this current state is good. And now it's speed. So we don't want to wait for the perfect solution, because every time we wait, people die in the current healthcare system. So speed is a very specific constraint for us. And for somebody like you in the technology world, that is technically the Agile Manifesto of 2001, and Agile software development. So I just took the Agile software development and expanded as a method of doing Agile science.
This is fantastic. I mean, one, a very clear and noble mission, a focus on speed to impact and use technology effectively. Can you give us a bit of an overview of some of the specific challenges we're facing, and as more and more people need healthcare, there's more chronic conditions, there's more incidents of conditions such as dementia. Like, what are some of the projects you're currently focused on, your team is focused on, that give you the most excitement?
I mean, we are focusing on two major problems related to healthcare. One is very, very hard, which is trying to, protect your brain. All right. So I don't know if you know, but to the best of my knowledge, I can transplant your heart, I can transplant your kidney, your lung, even your face now, but I can't transplant your heart yet. Now with Elon Musk and Neuralink and stuff, there is that possibility in the future. But for now, I can't transplant your heart. So the best way is to figure out how can we keep your brain as healthy as possible. So that's one major challenge. And then the other challenge is, what if you develop dementia, unfortunately? How can we make sure we optimize your quality of life and keep you living in the community as long as you can? So these are the two challenges for us. So we're looking for an integration of insight from behavioral economics, like understanding how the brain work and make decision, insight from complexity science, insight from network science, and then finally the revolution in artificial intelligence and computing and all these kind of things, to really overcome the issue of making sure we provide a personalized healthcare solution for you wherever you are in, ideally in the home, outside the brick and mortar of a healthcare system. So my ultimate goal for that vision is trying to eliminate 90% of current healthcare position, in my opinion, and trying to deliver that 90% through a very highly engaging, human-centric, some kind of avatar or a village of avatar, where they can be available for you on your need. You don't need to come over 8 to 5 only and face the situation of your healthcare management alone after hours or on the weekends. Or we don't want you to wait for having this highly expensive physicians and advanced care providers who are right now burnout, and they are really been traumatized with the COVID pandemic. And so in a way, they start thinking, I don't want to sacrifice my family all the time. And this whole concept of on-call, Adnan, that we took for granted, now we're questioning, why am I supposed to be on call 24/7 and ignore my family and my life, given the system during the COVID abandoned me? So in a way, there's been a lot of resentment of our healthcare providers. So this is why technology can scale up these amazing unscalable workforce and create a win-win situation. They can reach a larger number of people without sacrificing their family.
No, I think this is super timely. You touched upon key themes we hear across our space, which is the increasing challenge and burden on providers, the changing role and nature of a provider, the opportunity for technology to make the impact as you so clearly articulated. Talk to me about the piece that's often the hardest, which is like, how do you get investment for the type of change that you're hoping technology can deliver?
I mean, obviously you have to be lucky, as you know, like luck is everything. And so the question, how can you harvest luck? For me is to have amazing, a why, authentic why, package in a very personalized story, and told by the right storyteller. I mean, when I started working in the Center for Health Innovation Implementation Science and get these insights from behavioral economic, we looked at the human history, and we tried to look for what is the most effective and evidence-based change management techniques. And guess what? Storytelling has been going on forever, So we end up taking the impact of storytelling, insight from behavioral economics, and insight from agility. And we think right now the best way is to find a why and convert your why into a minimally viable story, and then find a right storyteller and have a feedback loop in that process to tell you if your story working for the right right VC or right person. So that's the big thing. I learned that from my work as a provider. A lot of time, just when I put my lab coat on, all of a sudden people listen to me. If I took it off, they don't listen to me. I'm still the same person. So I find out the messenger is very, very important, but you have to start with the why, and you have to convey to the when you get an opportunity to stand up in front of a VC, people who have been in this journey for quite some times. You have to tell them, obviously, big why, big story, forecast the future, but you also, at the same time, you have to convey to them your ability to pivot, or what we call having an agile mindset, that not fall in love with your solution. I mean, the scary piece for me when I started my entrepreneurship job is in the beginning, I fell in love with my solution and I lost a lot of money, and I was so wrong, on purpose. Since I start falling in love with solving the problem, which is subtle different, problem solving, you're supposed to be really obsessive about solving the problem, not the solution for that piece. That give me a lot of flexibility to give a why, package in a nice story for the right person, and pivot accordingly.
Spot on. I'm gonna go back to where you began, which you're a scientist first, and then a provider. And so, as a scientist who's focused on delivering the agile mindset, real impact, as a provider who's really at the leading edge of aging research and geriatric care, you've now led the center for 12 years, and you had a variety of students come through the center. And when I say students, for audience, don't think like bright-eyed grad students. These are folks who are very experienced and actually leaders at some of the biggest brand names, most innovative, impactful health systems all across the country. So your students are in a position where they're not only learning, but have the opportunity to make change. 12 years, you're looking back, like what are some of the examples that you've seen your health system operational leaders who've come through the program, like what are some of the changes they're driving that really give you, pride in seeing the results of the work?
Yeah, I think the big one, these students, we call them agile change conductor, and like you said, Adnan, they have opportunity to make decision. So I learned a lot from them, and I think they learned from our method. The big thing for them, they have a specific agile mindset. That's the big one, and because of that agile mindset and the tool that they used, we have created an agile processes for innovation, agile process for implementation and deployment, agile process for diffusion. And even the big one that we've been working on lately is agile analytic, the ability of the leader to make sure that they have a very low false positive and false negative. which is crucial in healthcare.
Mhm.
In the past, it wasn't crucial because we used to have a high margin, but now our margin is very small, and we're becoming like almost like a retail industry. And I don't know if you know, but the retail industry, they live and die on analytic because of their
Absolutely.
it's very, very small. And logistic company, so they have this agile mindset. And the agile mindset has a three principle that all of my students and scholar now, they actually master. And you see variation in their performance and their ability to be lead based on how good are they in mastering these three principles. So the first principle is psychological safety. They try to create psychological safety not for political correctness, it's literally they build psychological safety so they can have early signs of failure, so they can fail as often, as early, and as cheaply. All right.
Mm.
It's all about reducing the psychological safety, reducing the error in information exchange. They are aware that because they are in the C-suite, that they are at risk of people not telling them bad news. I mean, so they end up they have sensors embedded in their healthcare system to give them signal to tell them that they're going in the right direction or not, including capturing gossip and hallway conversations. So that's a psychological safety. The second thing they have is they invest constantly on creating a special type of feedback loop. And the feedback loop they look at not just timely, which is now with technology on board, you can do it. Not actionable. I think a lot of technology right now can give you actionable information and not obviously accurate information. They don't stop there. They do the hardest part of a feedback loop, which is getting a feedback loop that is non-judgmental for a human. Oh my gosh. I mean, they are masterful of converting the people who work for them, make them when they have a problem, kind of say it's not about you, Malaz. It's about the tool process strategy. Maybe they're not working. If they're not working, fire the tool process strategy. Don't fire yourself. Don't beat yourself up. So they do that one, and they understood very, very deeply the psychology of a human being. Like, for example, we have a terrible hippocampus. I don't know if you know, there's no way for say I can compete with AWS storage. I mean, my hippocampus is terrible. And it's efficient. Cool. Like when right now I'm talking to you, if I touch my brain, there's not much heat. So, it's very, very good. But it has it does that kind of efficiency through shortcut that has some false negative and false positive. So we make up story when there's no information. For example, we try to find information that will make us feel good about ourselves and all these stuff. So they are masterful of these feedback loop that are human centric. And finally, they don't let perfect be the enemy of good. So they create these sprinting concept and MVP, minimally viable everything. They do minimally viable experiment, minimally viable product, minimally viable solution, minimally viable dashboard. These three things, the agile mindset, they are done. And then the other piece they have figured out, they have high level of emotional social intelligence. So they know their weakness, and therefore they try to overcome that weakness by surrounding themselves with people who are better than them on a different way. For example, if they're not a good choice architectures, if they're not good in modifying physical, social, and digital environment to create nudges, they bring people on, or they bring over vendors to help them up. If they're not able to create a great storyteller, a story or great storytelling, they team up with people who are amazing producing story and telling story. And they look for these kind of technology to scale that up, because they are very fiscally responsible. And so they look for technology that can compensate for their weaknesses and allow them to convert their healthcare system to become an agile, smart healthcare system.
I love it. This has been awesome. One, I you see me here taking notes, so I love any opportunity to be your student. So my team's gonna tease me because I have the pencil out and I've been taking notes furiously. I think you grounded us perfectly into realities of a hospital or health system, right? In terms of the constraints and the realities of margins, shrinking margins, and then the human aspects of it in terms of the psychological safety, feedback loops, and the MVP approach that your team takes. This is very relevant, I think, for folks here. I'm going to switch gears quickly, and I know we can bring it home here with this. The realities of the health system we covered. I love the analogy you made to retail. I think folks will acknowledge the margin constraints, but not who we should look to drive more efficiency and innovation. But taking the innovation lens and taking the clinical side of your world, let's look forward. Like, what are some of the clinical innovations on the geriatric care aging front that really, really excite you? And I know Kara's going to poke me here. She's like, 90 seconds. So bring us.
Big thing is the concept of smart community, not even smart home. All right. It's smart community. So there is this concept of age-friendly community, age-friendly healthcare system, but has not been penetrated by technology. So can you imagine if you use technology to create an aging-friendly community that allow you to stay in your community, that can actually have an embedded sensors to tell you how your social function is, how your brain health is doing, everything else, and take that information and give you a highly engaging avatar and alert and reminder when you walk into the bank, when you go see somebody else. So I think smart, age-friendly, smart communities and smart city is the future, and that require technology embedment and psychologist embedment together, and typical architects, an actual civil engineer, these three things together. And ironically, at Carmel City, we are thinking about these kind of stuff. I just started serving on a commission for senior living for our city of Carmel, and we are thinking about age-friendly health zones and these kind of things to figure this out and really allow the creation of these smart age-friendly cities and neighborhoods.
Awesome. Dr. Boustani, thank you for your leadership here. I mean, look, I think all of us in this audience are healthcare technology nerds or healthcare nerds, but what you're talking about isn't just a healthcare challenge. It's a community, society, and ultimately the foundations of, democratic society type challenges. And we all know the data, right? We look at all the actuarial data. All of us will live to be a lot older. Our parents are going to live to a lot older. So very, very impactful. Huge thanks. This has been one of my favorite episodes because it's in the realm of healthcare technology, but has such broad application. And so thank you for sharing your time and insight with us today. And if there's anything else you'd like to share, I'll give you the floor to bring us home.
Well, nothing, just don't settle. We cannot settle. I think that's the big message for all of us. If we settle, people die. So that's the big thing.
Thank you, Dr. Boustani. Really, really appreciate you being with us. Sure. Catch you next week, another episode of Digital Health on Air.